Yeah.
I think we're live, Charlie.
Yep.
Oh, darn it. Hang on. I forget my phone.
Anyway, aloha everyone. This is Uncle Charlie Iona tonight. Mel and Charlie Live. It's the 1st of February, and we're on at approximately 6:46, trying to keep within that time frame so that we can do a little talk story before we bring on our special guest for tonight, which is the esteemed and distinguished doctor from the island of Kauai, was part of a team that did a study pertaining to how many people would come in without being properly tested and what it would be like and so forth and so forth. And that's the distinguished Dr. Lee Evslin will be joining us tonight. But right now, it's just me. Hey, it's just me and Uncle Mel. And yes, tonight, gang, please share this because we got a lot to talk about. And what that is we want to find out from one who practices medicine in the state of Hawaii. If you know the guidelines within your practice, do you go outside your practice beyond those boundaries and start to make statements that, just like Pfizer and Moderna, right? You cannot make certain statements because there wasn't enough studies done. But as a practicing physician, can you go and make a statement as if you know how that vaccine will react? And again, the jury is still out on this because we don't know if we know from all the studies right now that as an individual you will be protected from the harsh symptoms of this virus, but whether or not you'll be able to pass it on and carry it with you and pass it on like an asymptomatic person, we don't know yet. So are you qualified to make a statement that as if that will never happen? Because if you are, then please tell me. Uh, just tell me and be honest with me where the source is coming from, so we can read because it's interesting. A lot of us like to read up on this kind of stuff, but it seems like only certain people are being privy to that information, and the rest of the population is not. So,
Yeah, that's why I invited Dr. Evslin. We want to really get into the meat and potatoes about this because, I've been watching. I watch the K2N News in the morning, and then I switch to KITV. So I try to catch all the different newscasts because they're slightly different and they're different angles. But I do watch the morning K2N because Lieutenant Governor comes on, and while his position with travel, opening up travel with the second vaccine shot, it's he's softening now his approach and trying to say now that, yeah, well, we're looking for a good starting point for discussion. And but that's not what he's saying. He's saying is today he said in his interview with, I believe it was, I can't remember which, I think it was KITV on Facebook or Star Advertiser, and he said that as soon as we're done with 1B, the people in 1B, which is the 75 and older and the caregivers or the people that work in those hospitals, then he wants to launch it. What concerned me was he mentioned on more than one occasion, he said, this is the proposal that I sent over to the governor, and it looks like it's going to pass. And he said it maybe 3 or 4 times. He said, which is very or highly likely to pass. He said it different ways, but he meant the same thing. That it's pretty clear in my mind, based on what the lieutenant governor is saying, is that the governor is going to sign off on this thing. And he talks about the ramping up of vaccines, but yet all I hear from my messenger, in email, on my phone or text or on Facebook, is no one can get a stinking appointment. No one can get an appointment. And Maui is they have no vaccines. Maui's hospital is full. So I don't know if he's trying so hard to convince the people that we're everything's okay. And yet for the moment it is. I mean, we're not like New York or LA or any of that, but we are one cluster away from disaster because we are so isolated, because we have limited bed space. We're one cluster away. But he is adamant. And then you pair in the other thing too, he mentioned about uh, the question was asked about how the mayors feel, and he said, oh, they're very supportive. Huh. I haven't heard one mayor come forward and say they support it at all. And I think that is, he's trying to convince people. The only mayor I think that has come forward and talked about opening up is Mayor Blangiardi, who wants to open up bars and get away from the tier system and open up. The lieutenant governor had a pretty interesting discussion on gatherings. He said once we get the majority of the population vaccinated, because we'll have total immunity, we can have gatherings again. He's painting this picture, giving out this false hope, and it's very concerning. Very, very, very concerning.
Well, we do have some issues over the horizon. One is we just discussed it, and that is when the pandemic first struck, there were certain businesses that are classified as essential. They're almost mandated to stay open. Okay, grocery stores, hardware stores, like for supplies, service stations, those kind, right? Now comes the vaccine rollout, and we understand, 75 and over are kupuna, grocery stores because they're in front of a lot of people all the time. But essential like hardware employees who are in front of people all the time, they're not. They're in one seat. So there is some thought as to why they're separated. If you're in front of people, um, and you run the risk like anybody else, like in a grocery store, I would think you'd kind of be in that class to get vaccinated. I mean, that's what you want, right? To prevent. Well, first of all, you want to prevent from getting sick. Second, I was hoping and praying that you prevent it from spreading. But that is the great unknown. And that's what we're going to have more discussion about tonight. Secondly, I was previewed again to information because I'm on this Hawaiian Airlines thing again and looking at some more. You look at the cases closed now, and if you read the write-up, cases closed means that uh, employees who were affected by COVID and that they now were released to go back to work. And it says cases cleared 1,808. That means to tell me that there were 1,800 employees in Hawaiian Airlines that was infected and that they got, and still there's ongoing monitoring. Yet everyone that I've talked to said, Uncle, the company doesn't pay for testing. We got to go get it ourselves. So the thing is, if they go get it and only they get the information, a question arose today on one of my feeds is, do these numbers count in the daily count? And I said, well, if the employee pays for it, and it seems like, there's real, because some of them, they don't even get contacted for contact tracing. It only stays within the company. So then I'm asking myself, so how could it be part of the daily number count for the DOH if the DOH is not involved, right? So,
Well,
so
if they're going to if they're taking a test, if they're taking one of the spit tests that they buy off the shelf, then it's a different story. But if they're taking a test that goes to a lab, whether it's DLS or clinical labs, then the lab reports it to the Department of Health.
but
I just
every,
don't know where they're getting the
every,
test.
every single one that has written to me, I can say, because I have to trust that they're writing, I know who they are. They private message me. Not one of them on that report said they were ever contacted by the DOH. So they're going through this, it sounds like they're going through this exercise for nothing, really, if nobody's
Yeah.
making contact. And now
There's
you,
definitely a breakdown. I mean, we haven't heard anything about contact tracing. That's why the numbers are low. The numbers are low because we're not contact tracing enough. We're not contact tracing like you talk about, Charlie, getting beyond
Yep.
the first couple of names that they give you. We're not doing that anymore. They laid off. Remember when they laid off all of the contact tracers when we were, yeah. So, I mean, I think that's what, again, Charlie, you and I both know, and I think most of our viewers understand the strategy is to bring down the numbers so we can open up tourism. That's the strategy. It's always been that way.
Well, if you wanna bring down the numbers, then let me ask you this. Okay, just cheat. No waste everybody's time. When you know that 90 people tested positive, just say 10. Nobody gonna ask you show proof because they say no, it's private, it's HIPAA. Okay. So all this time for over close to a year now, all we've been doing is taking someone's word for it, right?
Mhm.
So if you want to do that, cheat. Okay.
Remember, the same, we're taking the word from the same people that told us, oh, by the way, we found 60 more deaths. That's the people we're taking our information from. So, again, the numbers are the numbers. I think when we look at the numbers from Hawaiian Airlines, that's quite alarming, and yet not one mention of it in the media.
Brother, I'm laughing because just imagine this. We get pencil and paper and we're trying to reconcile how many deaths, right? And all of a sudden you hear this loud, oh, and everybody stop and look at the desk right over your other thing, your partition. And you're asking, what's that for? And the thing is, uh, I, I think I would screw up the count.
Yeah,
Instead of 6, I was supposed to add 1 0 on top of that. It's supposed to be 60.
yeah. But again, no mention. I mean, nobody accountable. No one. It's. I'm frustrated because we're not hearing about Hawaiian Air. We're not hearing about the clusters. We don't get information. All we hear every day is how good we're doing and how well we vaccinating our people, and that by mid February we'll be able to open up our airways to the visitors. That's all I'm hearing. That's all I'm hearing. And so anyway, that's the reason I wanted to bring in Dr. Evslin today to talk to a doctor who's not just a physician, but he's also a um, former hospital executive. He's involved in all of that stuff. He knows what he's talking about, and he's very, very credible. And we're bringing him in right now.
Bing, bing. Oh, there he is.
Hi there. How you guys?
Aloha, Doc. How are you, sir?
Good evening.
Good.
Good.
How are you guys doing?
Doing fine. Doing fine.
We're doing okay.
Well, that's good.
We're fighting the fight. Feel like a one-legged man in an ass-kissing contest. That's kind of what it feels like right now.
Yeah, I could see that. But you guys are certainly acting like you have 2 legs for sure.
So yeah, we've been talking about a lot of things lately, and a couple of things I wanted to touch on today, Doc, like I explained or asked in the email, was number one is the Lieutenant Governor's new proposal to the governor that he, according to his interview today, he expects to get approved, whereby 12 days after getting the second shot of the vaccine, the second dose, you add on 12 days or 14 days, and you have total immunity and you can fly the friendly skies without any testing or quarantine. Wanted to get your take on that. And then the other thing is have a discussion about why is the priority in our state right now so focused on opening travel, bars, restaurants, activities, very little about schools, very little about finding a way to get our kids back in classrooms. So
I think those are 2 great questions and issues. So I agree with you. It's, high priority, both of them.
So let's start with the proposal, the new proposal saying that after your second dose, add on 14 days. and you have total or full immunity. I think he calls it total immunity. And como mai, no test, no quarantine, just come on over. What's your take on that, and what's your observations?
So since your email this morning where you said these are topics you were interested in, I made an effort to review in some detail what he actually said. The source was Civil Beat, so I didn't actually hear his interview. I saw this review of his. So this was Civil Beat of actually a couple of days ago. And he did say it was subject to the federal government deciding on transmissibility once you had the vaccine. So it didn't sound, 100% like it was a slam dunk. He was listening to some of the science in there. And, the science is fascinating. There's been a whole slew of articles saying 5 reasons to consider yourself not free of worrying about COVID once you get the vaccine, which I think you guys have probably reviewed on here. But, reason number 1 is it takes 6 weeks or so to become immunized, at least with the 2 current ones we have because of the 2 dosages. So certainly a certain number of people aren't going to be free of the virus until they've gone through that 6 weeks. And he does address that by saying it's 14 days after the last shot. The second thing is what's interesting is, when they say a shot is 95% effective, which is really high for a shot, it means 5 out of 100 are not protected by it. And 5 out of 100, grows to a pretty big number pretty quickly. That's 50 out of 1,000 and so on. So there would be a fair number of people that would be fully immunized and, wouldn't still be protected from the disease. But the biggest issue, which is what he kind of addressed a little, at least by saying the federal government is going to tell us how transmissible it is, they have actually no idea if the vaccine prevents transmissibility. So as I understand it, when they did their clinical trials, they took thousands of people, they immunized them, and they counted how many got sick and how many didn't after they got the vaccine, and they compared it to a population that didn't get the vaccine. And they found this really high number that 95% didn't appear to get sick, which is great news. But what it really means is that it's preventing people from getting sick. We really have no idea if it prevents you from actually getting the disease. And if you have the disease, are you just an asymptomatic carrier, or is there some replication going on in your nose or so on? They just don't know. And they're very quick to say, we don't know yet. So it's really jumping the gun to say anybody could start to fly and we're not going to worry about them if they have the 2 shots, because we have no idea if this is transmissible or not once they are immune from it. We know, thankfully, that the vast majority aren't going to get sick, but we have no idea if they would be somebody that can transmit the disease. And everything you say, everything you see, the CDC says over and over again, wait, we don't know yet. We got to check. We have to find out. There's some vaccines like the measles vaccine. You get the measles vaccine, you don't get the disease. At least, and what's interesting, even with the measles vaccine, we give 2 in childhood. I think the numbers are after the first one, you're 92% protected, and after the second one, you're 98% protected. The main reason they do a second vaccine for measles, for example, is the first one doesn't catch everybody. But with measles vaccine, if you have the vaccine, you're not going to be contagious once it's taken hold. Other vaccines like the flu vaccine, they don't know. And they particularly don't know with this vaccine if it's transmissible. And one more little kind of detailed piece of it, which is interesting. What they studied, one was they looked to see who got sick, and they saw that the vast majority didn't get sick. And then they also did some antibody testing. And they know that it does a really good job of mounting IgG antibodies, which are kind of deeper in the body. And these antibodies will then, because it teaches the antibodies about this virus, they will attack the virus and make it so you don't get sick. It's IgA antibodies that are actually more in the nose and the respiratory tract, your so-called mucosal surfaces. And that's where the virus goes first. And they actually don't know much yet about the response to the IgA antibodies. So there's a fair possibility that I could get the virus, get it in my nose, have it be quite transmissible there, even though when it gets deeper in my body and hits the IgG, my body's going to knock it out, but still it's in my nose and transmissible. And I could sneeze or sing or speak loudly or whatever, and out could come this virus that hasn't been that affected by the IgA antibodies. And again, there's CDC and all these organizations that look at this, they're just saying, we don't know. And then the final piece of this is the variants. What we really don't know is how many variants are out there, how many more are there going to be before we have herd immunity, and what's the efficacy of the vaccine for the new ones. Thankfully, they're thinking the UK variant, which I guess we have a little bit here in Hawaii, it does seem to work on the UK variant. They're suspicious that it doesn't work as well on the South African one and the Brazilian and others. These things are popping up almost weekly. So you put those two things together, I think it's premature to make a very aggressive plan to use the vaccine as a way to say somebody's safe, but I wouldn't say for sure that the future doesn't hold something like that. The more we learn about this, and if we do get ahead of it and there is so-called herd immunity, we may find that someday when we know more that is, not an unrealistic way to allow people to come in safely.
I think we all are hoping for that. We all are cautiously optimistic that one day we will find out. But and I realized, like, the lieutenant governor's message has softened a little bit since a week and a half or 2 weeks ago. But on Thursday, the memo that he sent over to the governor, and this is the one that's being discussed, which in fact he said today that there's a very good chance it'll get approved. And obviously it won't be able to get beyond or against any federal mandate or statute. But my concern is that it will be a while before the federal statute gets passed and is applicable to Hawaii. I emailed Dr. Fauci today because I was so concerned that if we continue on this road and believing what is being said about the total sterilization immunity, then we may be premature in opening up. So I wanted to show our viewers, this was from his memo that he sent to the governor on Thursday. So he talks about why, he talks about the need to open up and talks about the cases. But this is what scares me is if you look right on the top, where it says Green, an emergency room physician, noted that initial reports indicate the COVID vaccines offer sterilization immunity, meaning there's little chance an immunized person will spread the virus to others. Now, we have reached out, Charlie and I have reached out to numerous doctors, the CDC, any organized agency that is involved with COVID is not saying this. There's no reports or studies that even acknowledge this. And that's the scary part. And then this is the other scary part is following that, a quote, he says, all of these things recommend themselves that once we do have travelers, whether in Ireland or from the mainland, that are vaccinated, we go down to almost zero risk that they will transmit any virus. So if it's not a risk, this is the time we should be giving our state some hope and repairing our economy. And this is his timeline. The first changes proposed in the memo, this was on Thursday, would be triggered once the majority of those in the phase 1B priority group established by the state have been vaccinated. Vaccinations are well underway for this group, which covers adults 75 or older, first responders, and frontline workers. So once we get a majority of those phase 1B, then he goes into allowing inter-county travel with a pre-travel COVID test. If individuals have, without a pre-travel COVID test, if individuals have completed the required vaccine doses, plus 2 weeks. Resuming in-person instruction for the DOE and relaxing emergency rules and so forth. He's estimating, based on the track we're on for vaccinations, that the start date for these changes will be February 15th through March 1st. And then the scarier part is where he comes down and he talks about once the rest of the people, the majority of people in 1C, which is 65 to 74 and so forth, then we do the same exemptions for mainland travel. And he's expecting this to be done between April 15th and May 1st. So a couple of the scary parts is that this, we don't know, and there's no report or study that talks about this vaccine creating sterilization immunity or total immunity. It doesn't exist. But he's relying on this and setting the wheels in motion to open this up. And he said it again today, that his timeline is the vaccines that are being administered. That's the timeline he's using, and that's kind of scary. Kind of scary.
Yeah, I would agree. And the research I did kind of again today in anticipation of being on the show tonight was the same thing. I did not find anything where anybody is feeling very sure that this thing is decreasing transmissibility. They're just not. And the two big messages, it's interesting what's out there. There's a very scary message about the variants. Nobody really knows why this huge ebbing and flowing is going on. Why did California get hit so badly several weeks ago, and then now suddenly they're getting better, and England, and there's a feeling that these variants are doing more than we think they're doing, that they whip through a population, they make a huge number sick, even if they're not more dangerous themselves as a variant. If you make a larger number sick, you're going to get a larger number that are really sick, even if that particular variant isn't itself more dangerous. And there's a feeling that that's what's happened in these areas, is these variants are sweeping through, making a large number of people sick. And then, because 50% probably don't have symptoms, also getting a fair number of people who are then immune. And then you start to see this curve on the other side where it's going down. Plus, they don't know how much was due to the holidays. But I'd say 10% or 15% of the messages I'm seeing out there by the experts is they're really frightened about the next 2 months. And as Dr. Berriman says, she sees it as a race between vaccines in the arm and a tsunami. And we just don't know. I mean, it's nice that this seems to be going down everywhere except in Hawaii. It's interesting. Almost every state is decreasing except Hawaii right at this moment. But we don't really know what's making this ebb and flow. And if it's the variants that are doing it, and we've been somewhat protected from them, and they start to hit us and sweep through our populations, we end up in big trouble again. It reminds me, I was thinking about your show and what to say and whatever. Back when I was an active pediatrician, if you're a rural pediatrician and you get invited to high-risk deliveries, so you go in the high-risk deliveries, and most of the time you don't do very much. You stand by and the baby's fine, but some of the times, a certain percentage, the baby's really sick. So you resuscitate the baby there, and then you have to move the baby from there into the nursery. And it's highly risky because you have all these tubes and lines in, and they come out. And you become fanatic about looking for what's going to go wrong. If that oxygen tube comes off the tank, or that tube that you're breathing with comes out of the throat, or the little IV that you put in the belly button, if it pops out, all of these are catastrophes. And you're watching like a hawk. You're just waiting for each one of these to happen. And by being fanatically careful, you hopefully transition from the nursery, from the delivery suite into your nursery, and the baby's fine. And that's the same thing here. There's too many unknowns here, and there's too much really bad disease out there for us to take a casual approach to safe travels, number one, in my mind, and two, to the idea that vaccinations at this early stage are going to get you kind of a get out of jail free card. It's just too soon. And I was looking at trying to, the people doing this analysis to try to figure out how much transmissibility it's going to be there. And they said the main way they're going to know is just watching closely what happens to populations that are immunized. And if they start seeing in those populations this tremendous decrease, which would be fantastic, it'll build some more certainty into the fact that the transmissibility is going down too. It probably will go down, but I think until the experts are willing to tell us, we should not use that as a way to get on a flight and come here. Safe travels is bad enough to say that just opts you out of it with as little as we know now is, I think, a recipe for disaster. We may find by summer that it wouldn't have been a recipe for disaster, but to pretend that we know now, or to act like we know now, or to plan like we know now, that seems pretty dangerous to me.
When a population receives a vaccine, what you just said, does it make a difference where, we're like Hawaii's population is constantly evolving. We got people coming in, going out, people coming in, going out. So really it's always shifting. Does the shift make a difference? Because we actually don't know. We can say, given the population base of the vaccines provided, X number of have been vaccinated. But if that number starts to shift, we really won't know how many remain in the state and how many has gone out of the state, correct?
No, that's true. I mean, anytime you have a population like ours with the shifting that goes on with people traveling and with tourists coming in and even populations coming in from the other Pacific Islands and so on, it is hard for us to know exactly where we stand, for sure.
And the second question I had for you, Doctor, and I guess this is just a speculative one, and it's not I just wanted your read on this. When you received your license to practice, there were certain parameters. You knew that as taking an oath, do no harm, right? You took that oath to be really the best practitioner of saving lives, the best that you can be. So that meant that, if you were giving a child, say, a certain vaccine, like for measles or whatever, you knew what the parameters were, what you could talk about. Would you go beyond that? And the reason I ask you is because it seems as if the lieutenant governor, in my opinion, not anybody else, but in my opinion, it seems like what he says, even though it has a professional realm to it, it seems like it's going beyond. It's like it's stretching beyond what, like what you just said a little while ago, and that is, you try to look for information that would validate the statements he made, but we just can't find any right now as a physician.
That's a good question. Let me pick my words here a little bit. I am concerned that statements have come out of the state leadership that I don't think are based well enough on science, and we've talked about that before. And we knew in the Safe Travels program that it was going to be 7 out of 1,000 that would escape detection, and that's what turned out. That's really what it was. I thought then, and I still think now, saying that it would be 1 out of 1,000 when the math was faulty, and when we know 30 to 40% are missed by a single test, making statements that acted like that wasn't true, and belittling people, other physicians who were saying, no, wait a minute, this is a single test does this. And Dr. Fauci said the same thing. So I have been concerned that statements have come out of the state leadership that I don't think are as based in science as they should be. Mm-hmm. And I've also been taken back a little bit by kind of the aggressive way that often the rebuttal to people like me and Dara and others that are saying these things could be problems were that our approach wasn't scientific. When every scientist that we brought it to said, yes, this math is correct, that these are dangerous policies. These subjects are all very complicated. For example, on the other side of the coin, I don't think the spread of the virus has been as bad in the state as I thought it would be. I expect it's certainly gone to triple digits and stayed at triple digits, and I'm very worried about Maui, where they went from 1% of the cases up to like 18% of the cases. So there certainly has been spread, and we were one of the few states that it's not getting better, and it seems to be staying kind of constant. But on the other hand, I have a feeling that the R naught, that the number of people that a tourist infects tends to be a little less than the number of people that a community person infects, just by the nature of tourism. You know, you travel with your wife or with your mate or partner, and you stay with them, and that's your little bubble. So I have to say, we all have to respect the evolving science. We just keep learning about this. But it bothered me from the beginning that the numbers that were put out there by very credible scientists were, you know, acted as if they weren't correct or kind of scorned. And I thought that they went beyond the evidence to make their statements, and that was puzzling to me. And here too, I mean, I do see that he's saying we're going to wait for the federal government to tell us how transmissible this is. But I think I'm taken back a little bit by such aggressive plans to do this reopening based on the 2 vaccines when this much uncertainty is out there, both in the variants and what that effect is going to be on Hawaii and on the fact of the transmissibility once you've had the vaccine. So I'm trying to answer kind of carefully. I don't want to.
No. I perfectly understand. And I appreciate it, because this kind of leads into my next question before I give it back to Mel, and that is, and being very careful on how I phrase this, is like we're sort of at the mercy of the companies that produce the vaccine right now, because it's still ongoing that not enough vaccines are getting, I mean, there's talk that the president 200 million more doses, but and everything seems, there's sort of like over the horizon we have Johnson & Johnson, which is nowhere storage-wise anywhere near Pfizer or Moderna with the sub-zero freezing and all of that.
Right.
But it's a matter of when we get it and how many we can roll out, because it seems at this point that because of the scarcity of the first two, the Pfizer and the Moderna, it seems everybody's banking on the one-shot deal, which is Johnson & Johnson, right?
Yeah, I mean, that's going to make a big difference, and probably for the lower risk population in particular. Yeah, I mean, we're completely at the mercy of the supply chain, of the ability to immunize, and the actual, availability of these dosages as we go forward, and as the rest of the country, as the rest of the world makes their demands. I mean, there is this kind of unbelievable difference in the ability to get vaccine in richer countries versus poorer countries, and that's going to be addressed too, which is certainly going to make a supply chain issue.
I know, Doc, you were involved early on with the Kauai COVID discussion group, along with other doctors, and very active. And I'm bringing this up because there's a comment from one of the viewers saying, then why don't you go on TV and do a press conference? Is the doctors scared of them? So I just want to say that the COVID discussion, the Kauai COVID discussion group, that group was on many newscasts. Dr. Kapono Chong Hansen has been on the TV. Dr. Dara O'Carroll has been on TV. Our show hosted a press conference, which was viewed by numerous media outlets, even from the mainland. So the information is it's out there. It's been stated. The media picks and chooses what they want to run with. Right now, they're running with the opening of travel. I have been on numerous interviews, Facebook Live interviews with Star Advertiser, Hawaii News Now, and KITV. I have specifically asked the question for the moderators to ask the Lieutenant Governor, where is the science regarding the virus and transmissibility after the second shot? They don't ask the question because we all know the answer. So I just want to put that out there because Dr. Evslin and many others have been a very active part of trying to get the message out to the public, and they have been very successful. I just wanted to recap what you said. See, when they call Mel and Charlie fear mongers, that's fine because we don't have the medical background. We don't have the scientific background. But when they got aggressive against yourself and Dr. Chung Hansen and O'Carroll and Dworkin and all of these other doctors that participated in a true, accurate study, which actually proved to be true, to go after them and attack them as being not credible, I thought that was where they screwed up, and I I will never forget that, and that's when I realized this was bigger than science. This was really about tourism. This whole thing is about tourism, and how can we open tourism in a way that the public would think we care about their health and safety. And I don't expect you to respond, doctor, because I don't want I don't want you to respond, but I'm just saying to the viewer that is asking, you got to understand that the media operates in an interesting way. They all know there's not a reporter in print media or TV media that knows or that agrees with what the lieutenant governor is saying. There's no way, because every single news source, scientist, medicine source.
Well, Mel, let's maybe refresh the minds of everyone. The very first press conference that was held at the state capitol with the governor when this outbreak occurred, way back when, all of the important people that stood with the governor to talk about this virus was actually from the tourism industry. There wasn't one doctor on that advisory board, so that stood out in front of the cameras. True or not true, Mel? You remember that? You remember that time?
Mhm.
And still to this day, you and I always discuss, wait a minute now, if we take it back, would have been nice to have somebody like a Dr. Evslin or a Dr. Carroll or Dr. Chung Hansen to at least put a little spin of information from the medical science side. But no, we were talking about, okay, how much we're going to cut back on our flights. Flights to me have nothing to do with viruses. Okay, I just want to know how, maybe it has a little, because why? If the virus comes in through a traveler, yeah, it will affect the population on who gets infected and who doesn't. I get that. But that's what still stands out in my pea brain of mine, that I didn't see any doctors that day. And that was a pretty important press conference, I should say.
No, I can remember the very first one, something like March 11th in 2020. Bruce Anderson was head of the Department of Health, and he got up and they were just beginning to talk about flatten the curve. And he said, I don't think we should shut down tourism. We're going to get this virus anyway. We just got to live with it. And then, people began to say, wait a minute, flattening the curve is really important. We don't know anything about this virus. We don't know how to treat it. And, in fact, New York exploded and these other places exploded. And finally, a week or so later, they decided that flattening the curve was important. But I was kind of interested that the very first response is, no, we can't affect tourism. We got to just live with this virus, which was.
That press conference is what started this whole show. That press conference is what got me so pissed off. I may actually repost that video from March. I can't remember the date. It was March 20th. I think I did the video. Just an impromptu Facebook Live straight from my phone. I was so angry and the thing went viral. But that's what triggered me calling Charlie and inviting him to, let's go talk about this. But anyway, one more thing before we get to the schools. There is an effort by the legislature, Speaker of the House, Psyche, to pass a law that will really take away the authorities from the mayors to control their own island. I'm not sure if you're aware, but they basically want to allow safe travels for every island, and no mayor would have an opportunity to opt out because it would be a state law. And I think that's also dangerous territory. I think we all know that it wasn't our ideal situation to remove or to not have a mandatory testing after a quarantine, but we have it under control on Kauai, and to remove that authority, I think might be dangerous. What's your thoughts?
Yeah, I'm appalled by the bill. I mean, just appalled. One, again, that the idea that some kind of central government can tell the outer islands what to do. And I can see emergency powers for governors and legislative bodies that protect a population, but not to make a population less protected. So one, it's appalling that they would attempt to apply this. And we know, I personally, I think one of the drivers of this is they don't like the fact that, so Kauai, when we had safe travels for that 6 or 8 weeks, we went from 60 cases in 9 months to we doubled it in 6 weeks, basically up to 120 cases. Virtually every one of them tourist or travel related, either returning residents or tourists. And then we shut it down and we became one of the best counties in the country, probably, certainly one of the best here in the state. So it was very obvious that tourism was playing this huge role here. It's less obvious in other, in Oahu. It's obvious in Maui. I mean, I think our tourists went to Maui and they, as I understand it, they went from having about 1% of the cases in the state to having about 18% of the cases in the state. I don't follow Maui that closely, but I see every day 25, somewhere 15, 20, 25, 30 new cases happen daily, which is really a shame. And if you add to that the fear that these experts have that these variants may shake this whole thing up and before we're immunized, and the immunizations are coming, to force this county to do something different because of this desire to not confuse tourists, which seems to be the explanation for this, I think is insane. I think it's appalling, basically. And I hope, and as I understand it, our local legislative people are against it also. I believe. That's what I've been told anyway. And I'm hoping that they will take a strong position. And I'm hoping there's an outpouring from our county that this is an appalling thing to do, to tell another county that they need to take a less safe. And there are there are 3 things happening at once, I think. One is the variants are coming and we don't know how dangerous they're going to be for us or how widespread in Hawaii. 2, the immunizations are coming, which hopefully is going to lead to herd immunity and be much, much safer in a relatively short period of time, hopefully, if the variants don't make a big difference. And so to do something like break us wide open, before the vaccinations are more prevalent is crazy. And the third thing, which may be a really big game changer, is they are approving increasingly rapidly, very rapid, very accurate home tests. And I've seen proposals that are being floated out there that you could have tourists come in and the home tests, some of them are linked to your phone. So your phone reads the test through some kind of reader, and they're cheap, $10 to $30 a test. There's a proposal out there that tourists come in, they are in a bubble. They take one of these tests every morning. If the test is negative, they actually can go out and do things. If the test is positive, they have to act like they have the disease and they'd be quarantined. But what I'm trying to say is there are other avenues to safety that are on the horizon and pretty close. One of them out of Australia, one of these quick tests was just approved in the last week. They're going to buy millions of these tests apparently. So with things changing, with the immunizations coming, with the variants on the horizon, and we don't know what they're going to do to us, and the fact that with these simple tests, we actually might be able to change the face of everything, of schools, of tourists trying to visit the island, whatever, to take a bill like Psyche's and shake it all up and make us tread a route that's less safe at this moment. I don't have another word, but it's appalling.
Well, I think before we go into schools, it seems quite evident that in order for anything to work, we first have to, one, modify behavior. Because if people don't modify the behavior to go along with what is being proposed, especially having the traveler test every morning, okay, they got to be disciplined about it in order for it to work. And if they don't, I think that's wrong, is that, hey, we can stop this thing. Just avoid the large gathering. But then you see in Facebook all these large gatherings on Waimea Bay or whatever, or these guys on Maui, these drum circle groups getting together, no mask, and doing everything. I think we got to somehow come to the realization that if you don't modify your behavior, and we're not saying lose your rights, all we're saying is that sometimes you just got to be inconvenienced a little to prevent a lot. And I think I don't know, some people they just don't get that for some reason.
Yeah, and some of these articles that you're seeing, some of them are titled 5 reasons to keep wearing your mask even though you have the vaccine. And it's along those lines. One is we don't know if you're carrying the virus and if you're going to be transmissible. And there are people out there, immunocompromised people, people on chemotherapy, people with cancer. We have no idea what the vaccine is going to do for them. In other words, because their immune system doesn't work as well, we don't know what percentage of
Right.
them are going to mount. There were some preliminary results that said in one of the studies, 76% did develop immunity, but there's going to be this population that doesn't, and we need to be careful of them too. So masking is going to be part of our lives until we know more about what the virus does to transmissibility, for sure. And it's going to be a vital part of our life as we get hopefully towards the end of this.
Yeah, it's the unfortunate reality, though. I mean, it is what it is, and I'm frustrated whenever I see the pictures on Facebook of the gatherings, the local gatherings. You can't blame the tourists for them. It's our own people that again, we're one cluster away on Kauai. We're one cluster away from disaster because of our hospital resources and the capacity. So, guys, we got to be smart. Anyway, Doc, you're a pediatrician. You're our pediatrician. Loved you as our son's pediatrician, and so I consider you an expert with kids because that's what you did for so long. And the way I posed the question was, why are we? When I say we, I'm talking about we as a state, decision makers, elected officials. Why are we going over and beyond to do whatever we can to increase the number of visitors, increase the number of revenues, increase the number of bars opening up on Oahu, and not one word about schools? And I kind of wanted to get a perspective from you. We've had general discussions, but really the importance in your mind of kids being in school, in the classroom.
So the American Academy of Pediatrics, which is our Bible, basically, that American Academy of Pediatrics is most board certified pediatricians in the country, including the board certified subspecialists like pediatric surgeons and so on. I think over 60,000 physicians, and they put together the medical information that's out there, and they present it to us pediatricians in a way that's we can understand it, and they develop policies, and they're so well respected that a policy from the American Academy of Pediatrics here in America goes around the world, basically, because they are the preeminent organization for advice on how to take care of children. And they, in mid-January, came out with another statement on schools and children. And the opening line of it is the kids need to go to school, essentially, that this needs to be our priority, is to get the children into schools. So, on the one hand, I feel very protective in terms of being worried about tourists coming and so on. And on the other side of it, I agree with what the drift that you're discussing is getting the children in school is really important. It's been too long. And they, in their paper, and in a recent paper that came out from JAMA, which is a journal, which is another prominent medical journal, is one, getting children in school should be a priority. Biden just said that he plans to come out with national guidelines in terms of how to do that, which is really good. And I've been disappointed in this state. I've been disappointed from two perspectives. One is I don't think we've been aggressive enough about opening the schools. I think here, particularly on Kauai, where our numbers are, we meet all the criteria for in-person learning. And I don't think we've opened widely enough. It's interesting, the private schools have, and they've done, knock on wood, I hope, but they've done quite well being very careful. And the public schools have been a lot slower. And I know it's complicated. I know there's issues, and certainly issues with teachers worrying about being infected. But here's essentially what the American Academy of Pediatrics said. One is we need to open the schools, and we need to lean over backwards to open it. The kids need to go to school for mental health, for food reasons, for social education, and for just better education. There's a large number of children that aren't doing well in remote learning. And the other things they think they're understanding is, I'm going to back up a little bit. When somebody becomes a teacher or a pediatrician, the first year you're in training, you're sick. You catch everything the kids bring into your office. I remember as an intern, I was sick like 3 times that winter, and almost never catch anything. And I'm guessing teachers are the same way. And the reason is for many, many diseases, children are the transmission vector. The flu goes around, the kids bring the flu home to their families. Colds go around, the kids bring them home to the families. This coronavirus, even though it's a cold virus, it doesn't seem to act the same way. The transmissibility, particularly in the children less than 10, appears to be much less than other diseases. So part of what the American Academy of Pediatrics is saying is it's really important to get these kids in school, and the transmissibility appears at this time to be less in the elementary school kids, and we should lean over backwards to get them in. In the older children, the secondary, the junior high and the high school kids, they are probably as contagious as the adults are. But with precautions, they can also be educated. They can be educated safely. And there have been some recent studies that they've talked about. 90,000 people they looked at in North Carolina that went back to school in the fall. Almost no transmission in the school systems. I think they had maybe 30 or something in the school system out of 90,000, and 191 from community spread. So the school spread was much, much less. And what's interesting, a fear for the teachers has been getting the disease from the students. But it turns out the most dangerous person in the classroom is the teacher. The adults transmit this much more than children do, particularly the young children. And if you think about it, the teacher is doing the speaking. So if there is going to be, or doing the majority of the speaking anyway, and speaking with more force too, because they're trying to project. So they talk a lot about the conditions to open. And they basically say masking has to be universal. And I look at our DOE guidelines here, it's a little confusing what it says. It says children should wear masks in classrooms, but if there's greater than 6 feet of distance, they can take them off for breaks. That actually shouldn't be the case. They need to have the mask on virtually all the time because breaks can be misinterpreted in a lot of ways. And what I keep hearing is that there is a fair amount of variability in school, classroom by classroom here on Kauai, and I've heard the same thing for Maui, that some classrooms are very strict about masks and other classrooms aren't. It shouldn't be that way. The children, unless they have special conditions, need to wear masks over the age of 2, period. Out on the playground, if you're a pre-kindergarten and elementary school, masks are another issue, but in the classroom, even if you have 6 feet of distance, masks make a huge difference. And the other thing that there's tremendous variability about is ventilation in the room, which we talked about before. It's very clear that all the windows need to be open. And it turns out that there's pretty simple devices, carbon dioxide measurers that you can buy for $400. You can actually measure the carbon dioxide in a room. And they say it should be between 600 and 800 should be the measurement there. But they could do a better job of making sure that ventilation is good in the schools. And I've been disappointed. I've felt that whatever leads the DOE has allowed too much autonomy to the various schools and to the various teachers. It shouldn't be that way. Except for unusual circumstances, masks should be required for everybody in the classroom. And then you set guidelines up for how how they eat and how that process works and what you do for the older kids and how you try to keep them in their bubble and have the teachers transfer to rooms. There are details to this, but the details should be very specific and across the state. And then I think when we meet the guidelines, such as we have on Kauai, less than 2 new cases a day and less than 1% positive of the testing you do, the schools should basically be opened with conditions. I mean, you have to decide. The American Academy of Pediatrics goes as far as to say in the elementary schools, they would actually allow the kids to be 3 feet apart in order to get them all into the classroom. That's something I think schools could decide whether they're going to go to 3 feet in elementary school or require the 6. But we still could do, I believe, a much better job of opening the schools. And I think it's a huge priority. And yes, to your first question, this is our future, these kids. And this should be our priority. It shouldn't be necessarily opening bars, and it shouldn't be bringing in tourism and putting a population like Maui at risk. It should be doing what we're doing on Kauai, keep the population safe, but then take the next step and aggressively open the schools.
Now, wouldn't you think, first of all, you talked about some of the options that could be made available, same like with the traveler as with the school, and that is having people tested with these affordable, rapid antigen kits, right? If it hits the market, it becomes available. I mean, you can do and it's very economical. You can do probably a whole bunch of them. That's one. Two, you talked about opening the windows. What about if there were large fans that actually stirred the air? Because that's what they talked about in the airplanes, right? Because the aerosolized, the virus being aerosolized. I mean, I don't know how they picked out that particular number of 6 feet. It tells me, and in my work way of thinking, I talk, my droplets will go 6 feet and pew, die out, just drop. I said, no, I don't think that happens, but hey, what the heck? But if there's like movable air movers in the room that's constantly blowing all day, it doesn't even give it a chance. And maybe if it's blown into one direction, would it make a difference? How do you feel about that?
So, it's interesting when you look at the guidelines, they talk about opening all the windows and opening the doors. They like the doors open for two reasons. One, cross ventilation, and two, you don't have the children touching the handles of the doors all the time. So it becomes a high touch area, and it's better just for the door to be open. So step one is just opening them all up and trying to get cross ventilation. They talk about making sure that you don't have a fan on a person that then could spread their droplets to another person. So you don't want to do it in that fashion. They talk about the fans being exhaust fans. So they put them outside the window and they're drawing the air out. And I've seen literature, and I'm certainly not an expert on this, that the ceiling fans should be set on the exhaust mode rather than the coming down mode to kind of draw stuff up. But I would think, rather than a pediatrician without much experience in this having too many opinions, it would be relatively easy to have facility people go out to the schools and check them and kind of, take a run classroom to classroom. This is my advice here. This is my advice here. And those carbon dioxide meters apparently are easy to use and cheap. And if that becomes, a method of the future, so be it, where you can actually measure how much carbon dioxide is building up in the room, which gives you an idea of the ventilation in the room. And we need to, we should take advantage of our wonderful climate here. We have trade winds, and particularly at this time of year when it's not that hot, the trade winds blowing and the ability to air out these rooms, we should be aggressively taking full advantage of that. It's interesting, there were these good studies out of North Carolina and Wisconsin. There was a bad study out of Israel where there was a fair amount of spreading in the school systems. And they looked closer at it and they found that they had kind of weak mask mandates. And they were air conditioning the rooms because they were in the middle of a heat spell, and they were closing the windows and air conditioning the rooms, and they were overcrowded. So all three things that they know make a big difference was happening in this place that had an epidemic, in the school system. If you're going to open, it isn't just open. It's do these things right. Masks virtually all the time in the classrooms, thinking about how the bubbles work, thinking how the meals work, and getting the maximum amount of ventilation you can, and doing it with experts, people that come in and actually take a look. I would think in a couple of weeks you could have a person go to every school on Kauai, and or a couple of people, and give opinions on how to best ventilate space after space. And I know there are classrooms that don't ventilate well, then you use them much less. You spend your maximum time. And with a little bit of creative thinking, there's a lot of outdoor space that could be used. There's wedding tents and whatever that aren't being used these days. I would think the companies that have them would love to lease them for more outside activities.
Right.
That was my suggestion months ago. We'll get some GP mediums, military tents, and have them. You could set them up at the Vidina Stadium, Hanapepe Stadium, Kapaa Stadium. You could set them up along the width of the. You could have many classrooms in an open environment, very safe. It's quite embarrassing, I guess, for our state to be focusing so hard on a tier system to open up bars and restaurants and gyms and everything else, but no tier system, no benchmarks to open up schools. It's just interesting. We have no problem to accept the fact that you can put 200 or 300 people in a tube and put them in the air for 6.5, 7 hours, shoulder to shoulder, and no thought. That's fine. That's perfectly fine, because the ventilation in the plane has this magical properties that I don't know, destroy the virus. That's crap. But nothing about the schools. And we know, like you said, Doc, the private schools, not just here, but private schools on Oahu and other places are working and no one's getting sick. And that's just, I was just flabbergasting sometimes that the priorities of this state just not in the best interest, especially of our kids. And that's, I think, bothersome. And that's why I was hoping, and I'm glad you were on tonight because we get a lot of questions about schools. We can't get no one from the DOE to come on. But next best thing, pediatrician.
No, and I mean, I think what should happen, and I actually made a proposal that didn't go anywhere, that the DOH could even hire, retired pediatricians like me, but for no money, maybe we volunteer, but people with some medical training could act as liaisons to the schools to go in and say, okay, why in this classroom aren't you wearing masks? What's the issue here? Listen, you got to be a listener also. But I wish that the DOH and the DOE would get together on this. I hope Biden is going to force the issue. He said several times that there's going to be national guidelines about how to safely open schools. And the American Academy of Pediatrics is being very straightforward and specific in how to do it. So I'd like the vague, and the DOE guidelines, they're not necessarily terrible. It's just that they allow too much latitude in my mind. They say best practice is good ventilation, and you can have these breaks in the classrooms. So it's not specific enough. It needs to be right from the top all the way out. This is the way it has to be. This is what you have to do. You need to tell us if there's some reason you can't do it the way that it's being dictated, you need to tell us why. So the exception has to be an exception, basically, not left down to the individual teacher in the individual classroom.
Yep.
Or the teachers union. I think, the teachers union play a big role, and I understand, and I, by no way, shape or form am I suggesting we open the schools that are unsafe for the students or the teachers. I mean, I think you said it best. Set it up like Kauai did. Get the benchmarks. 1%, less than 1% positivity, then you open the schools. That's how it works. And then you add in the requirements. I think the masking is vital, and but that is yet to be seen, Doc. That's yet to be seen.
No, and it would, if those benchmarks were pushed out in the state, meaning you have to hit these benchmarks to do in-person learning, it would add more impetus for the other counties to want to hit those benchmarks and get their kids back to school. I mean, and that has such a big effect on the economy too. Not parents find it very difficult to work if they're also doing their in-home teaching of these children. We need to, one of the things that's positive about this, it's made the country realize how important our teaching system is. I mean, they are such a vital part of every part of our lives. Have children properly educated and properly occupied during the day so they're doing positive things. And one of the things they've shown is that children are at greater risk to spread the disease if they're out of the schools and clustering together in groups that kids cluster in, rather than in the schools with their masks on in a ventilated classroom doing the learning that they've been missing over this past year.
Yes. Well, it seems rather strange that we try to set examples for everyone to follow, right? So you take a nuclear spill, for example, in Japan. Once they know it's spilled, everybody stayed away. Everybody was suited up in all the best kind of suits you could have. But when you talk about this virus, they say, well, we don't know too much about it. So it may get us, it may not get us. And, when you talk about 400,000 plus that died from it, I don't know what more convincing you gotta show some of these people. But that's, and again, I go back to saying that, and you're right, Doc. It's about behavioral modification. A lot of the reports say that kids don't get the virus from schools; they get it from the outside. So the question is, what do we do? Do we start getting better discipline outside of the school to make sure that they don't bring it with them to the school? These are all kind of things that to me, I think has to be addressed, because the last thing you want to do is bring it from the outside, especially if they're sick, come in and just get one cluster start up from there. I think you want to prevent that from happening.
No, for sure. But it's been encouraging to know that this virus is not acting like the typical cold and flu virus where the kids spread it so wildly, particularly in the elementary schools.
Mhm.
That's a great piece of information. And it could, again, like all of these, it could be proven wrong. But at this point, that's the one that they're pointing at and saying, if you do these schools safe, if you do these schools correctly, they can be safe. And when you add the fact that the teachers are getting immunized, we build a whole nother layer of protection here because the immunizations, they
Right.
may be able to transmit the disease, but the high risk teachers, particularly older teachers, are going to be protected. And that's fantastic.
Yep. We allow them to go to Costco and Walmart and everywhere else and congregate at the malls. It's just incredible. But anyway, well, Doc, man, that hour went by quick. Appreciate you coming on. Any closing thoughts to our viewers before we call it a night?
No, I'm going to keep researching this issue of, decreasing transmissibility because of some of sterilization that's been proven. As I said, I didn't come across it with my research in the last couple of days, and particularly today when you emailed me to come on the show. But I'm going to keep on top of it. I mean, at some point they're going to know more. It's just that it's premature, I think, think we know it at this point.
Right.
And once again, you guys, you call yourself a one-legged something. It's unbelievable what you've done with this show. I mean, I truly can't believe it. Night after night, and interesting, and so pertinent, so on subject. It's staggering what the job you guys have done.
Thank you.
I it's staggering. You're right. It's just, it's kind of bizarre. It's like it's automatic now. It's just automatic. And we don't even know what the hell we're going to talk about most of the time. But we just,
You guys have become like two Johnny Carsons or two Larry King. You're so natural at this.
Charles.
Well, as always, I'd like to take this opportunity to thank Dr. Evslin for joining us tonight. I really appreciate his insight. A lot of good information that he got to share, and it's always worthwhile for the viewers to, again, like we've said it many times over, we get the information to you. Hopefully, that it will sink in, and you can adhere to some of what he says. And if not, we wait for our next guest speaker, and we go from there. But we always try to bring the best that we can. And something was said tonight, and I appreciate his willingness to continually look for the answers. And that is, we know that right now, because of this pandemic has gone longer than what many have anticipated would have gone. They thought that maybe it would be winding down already, but it hasn't. It looks like it's just with the variants, everything is going. It's going to go in different directions. We just have to be really disciplined about how we conduct our lives and how to keep ourselves safe. And the thing is, right now, our mental abilities, our mentalness is really fragile. So when someone says something, um, even if we say something that might be too good to be true, question it, because you have the right to do that. But like anything else, you go research and you find out, hey, are we on the right subject or not? And I'm just directing this to like a lot of the comments that have been made about the sterilization with regards to this vaccine. I don't, me personally, I just don't care for information going out and touching someone who's very fragile right now, because they can do things that maybe they wouldn't have done otherwise. And I'm just hoping and praying that we get some answers soon. Everyone knows that the vaccines received an EUA, so that means that we're still test subjects ourselves. So maybe we can provide some answers for the people up at the CDC and the FDA about how these vaccines work on the population. But we hope and pray everyone stays safe. So thank you again for joining us tonight. Mel?
Thanks, Charlie. Thanks, Doc. Again, appreciate you coming on, sharing your insights. Someone just posted, it's nice to have a doctor on that doesn't have an agenda. And that's probably the best comment of the night. And we appreciate that so much because it's just straight talk, which is what we like to do. And I want to make it clear. I know I see some of you that have chosen to keep your kids at home and do 100% distance learning. that's fine. I mean, if you're not comfortable, and I'll be honest with you, at this stage, I'm not comfortable either because the policies haven't been put in place. But we need to strive for to get to that point quickly to get our kids in. Many of us, like myself, I don't, I got to go to work every day and I got to deal with people that sometimes are very questionable. But we do it because we got to get the mission accomplished. And I think that's a very important mission, our kids' education, that needs to be done. And we got to all strive to that end. And I'm hoping that that happens sooner than later. Doc, you're always valuable comments. We appreciate you. Again, tomorrow night, people will have Les Kondo from the auditor's office, the state auditor's office, and he's going to be talking about the recent actions by the legislature to get rid of them, which is interesting. He just come up with an audit on ADC, a very factual, truthful audit. They not want to get rid of them. So he'll be on tomorrow night at 7 o'clock. We hope you guys can join us. Aside from that, Doc, yes.
Can I just say one last thing? I just want to echo what you said about honoring the parents that want to keep their children home for one reason or another. If you can, I do think this is an important time for people to make their individual decisions about that. But that doesn't take away from the fact that we need to lean over backwards, as the American County Pediatrics say, to open those schools and to open them safely and to make the policies be uniform through them. But I do think this is a time that's different than anybody knows in the last 100 years. So families by family do have to make their own decisions about their own safety and what they think their children need and so on. But we need to provide this school system in a fashion that's better than we have at this moment. Across the country, this is. But I think here in Hawaii, with our climate and our fresh air and our trade winds, we ought to be able to do it.
Real quick, this is going to be my closing. A text from a teacher. She said to please pass this along. Teachers are not babysitters for parents during a pandemic. You have chosen to have kids. You can be responsible for them until everyone is safe. Just passing it along. Very emotional issue, but
no, and I just to answer that, I mean, I know it is an emotional issue, and I think what it's teaching us is how vital the teaching world is for our children. I mean, basically the losses that they're sustaining without it. And if there's a middle ground where we can make the schools safe and make them open and listen to, bodies like the American Academy of Pediatrics, I think we should provide that environment to the best of our ability, particularly as the vaccinations are coming out. I think not to do that. And it's not that they're being used as babysitters for the children. It's what they give to our children is so vital, and we need to applaud them at every chance we get. But I think making the schools safe and the ability to open them is an important step.
Right.
and it's the state's responsibility to get us to a point where we believe that it's safe for our kids to go. That's the state's function. So awesome, Doc. Again, thank you very much, everybody. We'll see you guys tomorrow night, 7 o'clock. Take care. God bless. We love you guys. And of course, stay safe.
Aloha.
Aloha.
Bye-bye.